Fever is one of the most common presentations we get to paediatric emergency departments. Parents are often worried, and we see children with fever every day. And of course, we worry about sepsis, but actually most children with fever are well with viral infections. In spite of it being so common, there's lots of fever myths that are still floating around. In fact, it's not the fever that we worry about itself, it's what's causing the fever and how well or unwell the child is. Here, I'm going to bust the 5 most common fever myths in well-looking children. Myth number 1. The higher the temperature, the sicker the child. Fever is actually a good thing. It's a sign that our body is mounting an immune response to fight the bug and stop it growing. There is no correlation between how high the fever is and how sick the child must be. We often see very well children with fevers of 40, but we also see very sick children with fevers of 38.1. So don't worry about the height of the temperature. The exception to this is in very young children, so especially in babies under 1 month old and also under 3 months old. We tend to be much more cautious in this age group, and often we will treat the patient with antibiotics just on the basis of fever alone. Myth number 2. If the temperature doesn't come down with paracetamol or ibuprofen, then it means that the child is more seriously unwell. This isn't true. We don't know why some fevers respond to paracetamol or ibuprofen and some don't, but there is no evidence to suggest that that correlates with how unwell they are. So don't treat the child in front of you any differently just because their fever didn't settle with antipyretics. Myth number 3. We need to get the temperature down before we can send the child home from the emergency department. This isn't true. Most children that we see with fever have viral illnesses, and that is not going to be resolved during their time in the emergency department. It also gives families the wrong impression for when we're sending them home from the ED. It's the red or amber flags that we worry about from the NICE fever guidelines. If the child doesn't have any of these, then it really doesn't make any difference whether or not the child's got a fever when they go home. It's likely that after they get home, they're going to get another fever anyway. Myth number 4. Rigors mean that there's a serious bacterial infection. We know that lots of children get shivery or have rigors when they've got an infection, and there's no evidence to suggest that that means they're more likely to have a serious bacterial infection. Much better to look at the NICE traffic light guidance and look for amber or red flags. Don't make your decision based on the presence or absence of rigors. Myth number 5. We have to treat a fever with antipyretics. We've already talked about how fever is a good thing, so there's really no need to treat it just for the sake of it. Treat the child based on their symptoms rather than the temperature itself. We see plenty of children who are happy and playing with high temperatures, and if that's the case, you really don't need to give them antipyretics. Some children are miserable and feeling unwell with a fever, and in these children, it's a good idea to give them antipyretics because bringing their fever down is likely to make them feel better, and that's likely to encourage them to drink more, and that's a good thing. So, treat the child, not the numbers. I've added a few links underneath this video to Ali Monroe's blog post on fever myth busting and mine on rigors. Consider these myths officially busted. Fever alone isn't enough to cause concern. Use your assessment of the child as a whole to make your decision, and use the NICE fever guidelines to help you decide when you should worry and when you can be reassured.